Hello, my name is Katie Fulfer, and I'm an assistant professor in the Department of Philosophy and the Gender and Social Justice program. I'm so delighted to be with Beatrice Lawson today to kick off our Student Showcase series. This series is intended to showcase the excellent research done in gender and social justice courses. So Beatrice, thank you so much for your time today. Can you please tell me a little bit about yourself and what you're studying?
Absolutely. I'm so glad to be here. I am a fourth year history student at UW. I was previously in math for a couple years, but I found that history was more of my calling. And I've taken a number of gender and sexuality history courses um, that I've loved so far. So, yeah.
And we're going to be talking today about your paper, which is Whores and the Pox. Can you tell me briefly about the class you wrote this paper for?
Yes, it was a fourth year history seminar with Dr. Croker, and it was Sex and Gender in Early Modern Europe. For this paper, I wanted to really look at some of the large changes over the period. So that meant that were initiated by the syphilis epidemic that started in the late 1400s and really ran through the 1500s and the 1600s. And I wanted to look at the impacts of that and its effect on health and sexual politics in the era.
Great. Well, I just have a few questions for you to share with the internet about what you learned investigating syphilis as it developed in the early modern period.
Mm-hmm.
So, in your paper, which is Whores and the Pox, you connect the syphilis pandemic with changing cultural meanings around sex work and witchcraft. Can you tell me what your research revealed about each of those connections? And let's start first with syphilis and sex work.
Mm-hmm. Yeah, syphilis really created a new, heightened level of anxiety around sex work. Previous to the late 1400s, sex work had really been seen as a necessary evil, you could say, in society, where people had just accepted it as a part of everyday life. But with syphilis came a new idea that prostitution was responsible for this huge health crisis across Europe, which was, from my research, a bit of a exaggeration or a scapegoat that really created a moral um, consequence or these prostitutes were now seen as morally reprehensible, and it just completely changed the meaning of sex work, which is something that I think has continued to this day, this view of sex work as very deviant.
Did syphilis contribute to changing social norms around sex workers more particularly, or not more particularly, but in addition to sex work broadly?
Definitely. Sex or prostitutes specifically were seen as largely responsible for the syphilis epidemic, and really none of that same responsibility was put on their male clientele or other people who solicited sex work. So prostitutes themselves were targeted in this way, and like other populations that had a significant role in spreading syphilis. For example, soldiers and members of the army who were responsible for a lot of moving the disease around the continent weren't seen as associated with syphilis in the same way that prostitutes were. So they really were seen as uniquely sort of responsible. And that responsibility was taken away from men basically entirely, who were seen as very innocent in this whole deal.
In your paper, you argue that the image of the sex worker as the vector for syphilis, the site of responsibility, is actually false. Could you tell us why it's a false attribution to put all the, not just, the gendered imbalance, but why is it actually false to think that sex workers were the center of the syphilis epidemic?
Yeah, like I said before, it was like there was none of that same responsibility put on male clientele. So as like everyone knows, it takes two people to sort of engage in that sort of work, and it was really largely taken away um, from men any responsibility for sexual health, and they were seen as victims of prostitutes, who were seen as these like people who had men's health, both sexual and otherwise, in their control, which was largely seen as like sort of taking control of men's sexuality away from them. So it could be seen that these forms of control over men were demonizing factors to prostitutes that really created a sense of um, created a sense of responsibility that wasn't necessarily there.
Wasn't there something about the numbers too, that it just wasn't the case, that syphilis was mostly spread through sex workers?
Yeah, definitely. In like when it had become an epidemic, um there were largely like equal percentages. I looked at one town in Italy, or I think it was Venice specifically, where there were equal percentages of prostitutes and non-sex work or women who weren't engaged in sex work who had enrolled in a hospital who had like self-reported that they had syphilis. So, really, by the point that it reaches an epidemic level, prostitutes weren't uniquely affected in any way. It was affecting all areas of the population.
As you've just been explaining, it led to these like vast cultural changes around how sex workers were perceived.
Mhm.
Yeah, thank you for that. I want to transition now to talking a little bit more about witchcraft. Witch hunts and trials for witchcraft provide an example of systemic violence against women. What role did health in general and syphilis more specifically play in justifying this violence?
The women who were accused of witchcraft were largely midwives and older women who were often gone to as local healers and responsible for taking care of pregnant women and basically seen as having access to health of both women and the community as a large. And then when the syphilis epidemic broke out, this of course meant that there were much more complications with pregnancy when the disease hit an area. So midwives having access to pregnant women combined with disease that people didn't understand, affecting mortality rates of children, of miscarriage rates, they were largely seen as like a scapegoat or someone to be blamed when people didn't understand the source or how this illness worked. Um, and then additionally, uh, midwives and witches were like being older women were sort of outside of this reproductive community. So it was sort of a seen as these people who had fulfilled their social use as women who were supposed to reproduce, and they were seen as expendable. So that created another layer um, of blame on them or ability to be blamed and seen as disposable.
Yeah, wow. And I should have backed up a bit and asked you first. Um, was there anything else that you wanted to say about what your research revealed between the connection between syphilis and witchcraft and changing cultural meanings?
Yeah, they definitely, or like primarily the syphilis epidemic and the witchcraft like craze um, arose at the same time, and they were linked to, they were both seen as an era or contributing to an era of heightened anxiety around sexuality, around health, around personal autonomy. So in that case, I would say that there is like an inherent connection between them just in their effect and the reasons like that they grew to such like proportions in the era that they arose in.
Now, at the very end of your paper, you make a very provocative claim that the history of syphilis, and here's a quote, holds a new sense of solidarity and relevance. It's the end of the quote from your paper. For us now, living amidst the COVID-19 pandemic. I was wondering if you could expand on what you think this solidarity and relevance is.
Throughout my paper, I sort of examined ways in which vulnerable populations were scapegoated, specifically prostitutes, like we mentioned, and older women, in the case of like accusations of witchcraft, were unfairly seen as scapegoats or entirely responsible for the syphilis epidemic. And when I was sort of reaching this conclusion, it really made me think of like in the time of COVID how many people are being blamed for this. And it specifically made me think of, for example, Trump calling it the China virus or unfairly blaming Asian populations, which is of course newly relevant right now, and just shows how in eras of anxiety we really blame the most vulnerable population very unfairly that can lead to like horrific violence. So that was just something that I was thinking of that really creates a through line to today and other health crises of the last like couple decades. So yeah.
Yeah, thank you so much for your time, Beatrice. I really enjoyed reading your paper, and I hope everyone out there has enjoyed hearing a little bit about the research you did in witches, whores, and the pox. So thank you so much.
Thank you.